Hey, welcome to medicine.com. Today's topic is about diabetes, and I think most of you have already heard about it. It's a chronic disease that the blood glucose stays in a high level over a long period of time. And normally we obtain the glucose from the food that we eat every day, mostly from starch-rich food like noodles, bread, and rice, etc. And then the pancreas would produce and release the peptide hormone called insulin to help us use and store the glucose, basically keeping the balance of blood glucose. But in diabetes, either the pancreas doesn't produce enough insulin, or the cells cannot use or respond to insulin well. This is the global report on diabetes from the WHO, and you can see there are about 423 million adults were living with diabetes in 2014, and also because about 1.5 million deaths in 2012. And actually, diabetes is also a major cause of blindness, kidney failure, and the lower limb amputation. You can find this report on WHO website, and I also put a link down below so you can check it out for more details. But having diabetes is not the end of the world. People can still live a longer and happy life if they manage well. And the key starting point for living well with diabetes is early detection. This is really important. So here I'm going to talk about 3 lab tests for diabetes. The first one is blood glucose. As you can see, there are 2 different glucose tests. One is fasting glucose test, which generally included in the yearly checkup, and the other one is random glucose test, and I will talk about it later. So, the fasting glucose test is performed after about 8 to 10 hours fast, no food, no drink, but you can have some water. The reference range is between 70 to 100 milligrams per deciliter. But if the level comes to 126 or higher, it might diagnose as diabetes, but still need to confirm by a second test. The other one is random glucose test. This test can be performed at any time of the day and no need for fasting. If the results come to 200 or higher, and also with the classic symptom, it might indicate having diabetes. And the second one is oral glucose tolerance test, also called OGTT. This test can be used to observe the ability of processing the carbohydrate, and is performed when diabetes is suspected or the doctor is not able to obtain a clear diagnosis from the other test. So here's how the test works. The patient has to drink a solution that containing 75 grams of glucose, and then take a blood sample after 2 hours. If the blood glucose level below 140 mg per deciliter, it's normal. But if the level is more than 200, it will indicate having diabetes. The third one is HbA1c test, or glycated hemoglobin. The main function of this test is monitor. So here the hemoglobin is a protein in the red blood cell, and it would interact with the blood glucose and form glycated hemoglobin. So by measuring the level of HbA1c, you can know how's your blood glucose control in these 2 to 3 months. And also it means how well your diabetes is in control. So remember the number 6.5%. If the level is above 6.5%, it would be diagnosed with diabetes. And maybe you should adjust some details with your lifestyle. So that's it for today's 3 lab test for diabetes. If you like this video, you can check out more other topics on our YouTube channel. You can subscribe it. Also, you can visit our website and leave a comment below here. Any suggestion, question, or simply anything else you will also like to know, leave your reply here. We would love to hear from you. See you next video.